I'm going to be your nurse. I'm going to do a physical assessment on you just from your head to your waist. And I'm going to inspect your skin for the color, temperature, moisture, texture, any edema, turgor, bruising, scars, lesions, and any birthmarks. And you do have a little birthmark. And now I'm going to inspect your head for size, symmetry, in midline position. And now I'm going to palpate your head and your scalp for hair distribution, color, texture, lesions, masses. Do you have any tenderness?
No.
And there are no depressions. And I'm going to palpate your temporal arteries and your lymph nodes, your pre-auricular, post-auricular, and occipital, tonsillar, submandibular, submental, in your anterior cervical, posterior cervical, and your supraclavicular. And I'm going to test your cranial 5 nerve and ask you to clench your jaw. And then also for TMJ, and open your mouth, please, and close. And close your eyes and tell me if you can feel this.
Yes.
And now I'm going to test cranial nerve 7 and ask you to smile and frown and raise your eyebrows, puff your cheeks, and pucker your lips. And now I'm going to inspect your ears for the shape and position. Do you have any questions so far?
No.
Okay.
Do not.
Okay, now I'm going to inspect your auditory canal, and the tympanic membrane is gray, and the light reflection in your right ear is at 5 o'clock, and in your left ear it's at 7 o'clock. And now I'm going to do the whisper test. Just tell me what you hear.
Purple. Red.
Okay, and now I'm going to do the, okay, I dropped my tuning fork. The Weber test. Tell me if you feel this.
Yes.
And when it stops.
It stopped.
Okay, and now tell me when that stops.
It stopped.
And now when it stops.
It stopped.
Okay, and air conduction is greater than bone conduction. Now I'm going to inspect your eyelashes, your eyebrows, and your palpebral fissures, your sclera, your conjunctiva, and look for any color or discharge. And now I'm gonna test cranial nerve 2 and just follow my pin light with just your eyes. And this is the cardinal sign I'm testing for. I think I did that. Okay. And now I'm gonna ask you to cover one of your eyes and read the numbers.
1, 2, 3.
And now cover your other eye.
1, 2, 3.
Okay, and now I'm gonna test your peripheral vision, and just tell me when you see my hands, my fingers.
I see them.
Okay, both eyes. Okay, and now I'm gonna test cranial nerve 3 for your pupillary response and constriction, and now I'm gonna test for accommodation and convergence, and you're good. And now follow my pen line. Okay. And okay. Do you have any questions yet? Okay. Okay. And okay, I did the wagon wheel. Now I'm gonna look in your eyes for the red reflex. Oh, I see it. And now I'm gonna look in your nose for patency, and it's been lying straight, and Have you ever had a deviated septum or a broken nose?
No.
Okay, and your frontal and maxillary sinuses? That's those two. Oh, these two. Okay, and now I'm gonna inspect your mouth and your tongue and your tonsils. Say ah. And I checked for TMJ and stick out your tongue. And now I'm gonna inspect the skin on your neck for color, temperature, moisture, texture, edema, turgor, bruising, any lesions, and nevi, and your trachea, is it midline, and I'm gonna palpate the thyroid gland from behind. Okay, now I'm gonna ask you to swallow. Oh, that's cool. And now I'm gonna palpate your carotid arteries one at a time so you don't pass out. Now I'm gonna auscultate for bruise. I'm gonna use the bell. And now I'm gonna test your range of motion in your arms. Can you lift them up all the way and then back? And then can you shrug your shoulders against resistance? Okay, and that was testing cranial nerve 11. Okay, and do you have any questions? Now I'm gonna inspect your back, and I'm gonna look for again the color, temperature, moisture, texture, edema, turgor, bruising, scars or lesions or nevi, and I'm assessing for any signs of respiratory distress. And I'm gonna look for obvious deformities and symmetry, and I'm gonna palpate for symmetrical chest expansion. So take a deep breath, okay? And now say, this is tactile primitive, so can you say 99?
99. 99.
Okay. And I'm going to percuss. Oh, over here still. And now we go all the way down. And I'm gonna listen to your lungs now. Now I'd listen all the way down. And now I'm going to come over here. And I would test for, listen to all your lungs in the front and test for egophony and bronchophony and the whisper. And I'm gonna come back here again. And now I'm gonna ask her to say E, E, and now E again, E, okay. And then whisper 1, 2, 3, 1, 2, 3. Again. 1, 2, 3. Okay. And then now I'm gonna come over here. Now I'm gonna again inspect the skin for all those things I've said before, and palpate for chest expansion and tactile firmitus like I did back there. And I'm gonna listen to her lungs and all 4 fields up here, here, here. And then for the abdomen, or actually not the armor. Do you have any questions? Mm-mm. Okay. I'm gonna auscultate your heart now. we'll do that. We'll listen in aortic, pulmonic, Erb's point, tricuspid, and your mitral. And I'm gonna identify and palpate the point of maximum impulse and auscultate the apical pulse for 1 full minute and report the findings like the rate and rhythm. And now I'm gonna ask you to lay down. Okay, I'm gonna inspect for any heaves or lifts and palpate for any thrills over each auscultation point. And and I would ask you to flip on your side and then palpate and repeat the cardiac auscultation. And I'm gonna assess for jugular vein distension and for jugular pulsation with the head of the bed up 30 to 45 degrees. Okay, now I'm gonna ask you to empty your bladder before I do your abdomen assessment. And again, I'm gonna inspect the skin for all those things that I've said a bunch of times, and inspect for contours or symmetry. And I'm gonna auscultate for bruits, with the like aorta and renal arteries and iliac and femoral arteries. And I'm gonna listen for bowel sounds in all 4 quadrants. And I would listen for 5 minutes until I heard bowel sounds. And now, do you have any pain in your abdomen right now?
No.
Okay. And I'm gonna percuss in all 4 fields or quadrants for tympany, dullness, and flatness. And if she had pain, I would palpate where the pain is last. And I'm gonna palpate for tenderness, any masses, and palpate for the liver and spleen, and that's when I would like. And I would and I would put 1 hand under, and then I would ask her to sit up and check for CVA tenderness.